I now wish to invite you to attend the discussion of the panel that we have convened to exchange views on the challenges facing Ombuds institutions in advancing the rights of older people. I am now passing the baton to Mr. Jonathan Markovich, Senior Head of Department of the Office of the Ombudsman, in order to lead the panel. Jonathan?
Thank you, Ronit. Good evening, good morning, good night, or good afternoon, depending on where you are presently situated on the globe. My name is Jonathan Markovich. I have been ombudsmaning for the last 30 years or so. It is my honor to moderate this international panel of experts on the subject of defending the rights of older persons in an age of longevity. When we started planning this panel, I said to myself, how important to defend their rights. But then I realized it's not just them. If we are not already considered older people, we are all hoping and praying to merit to be one. We are investing in our own future. The aim of this panel is to share experiences, describe problems, and provide insights and practical advice to all of us. And now it's my pleasure to introduce our panelists. First of all, Rob Behrens, CBE. Rob, from the United Kingdom, is the Ombudsman of the National Health Service in England and also the UK Parliamentary Commissioner for Complaints. He is also the Vice President of the IOI Europe and a member of the IOI World Board. Good evening, Rob.
Hello, lovely to be with you.
We have also Karen Gomez Dumpit from the Republic of the Philippines. Karen.
Good evening from Manila.
We have Karen here from Manila, from the Republic of the Philippines. Karen is a Human Rights Commissioner. Amongst other things, she is a focal commissioner on aging and the rights of older persons. It's past midnight in Manila. And so good night, Karen. And now for our third panelist, Mark Miller. Mark Miller from the United States is the long-term care ombudsman and legal counsel for the elderly in the District of Columbia, Washington, D.C. He is the president of the National Association of State Long-Term Care Ombudsman Programs. Good morning, Mark. And now we'll go across to Sylvia Perol-Levine, usually from Switzerland, but presently in Bulgaria. Sylvia is the chairperson of the NGO Committee on Aging in Geneva and the representative to the UN of the International Network for the Prevention of Elder Abuse and International Longevity Center Global Alliance. Good evening, Sylvia.
Good evening, Ariftab.
And now over to Professor Israel Issi Doron from Israel. Issi is the Dean of the Faculty of Social Welfare and Health Sciences at the University of Haifa, the former president of the Israeli Gerontological Society, and the founder of the NGO Law in the Service of the Elderly. Good evening, Issi.
Hi, everyone.
And now to you, our audience. It's not just us. Please participate you also through the chat box and pose to us your questions. We're going to start now. First question to Karen. Karen, first of all, we're past midnight, and I was wondering if all your staff are awake and watching this panel.
No, they're not. They're asleep, actually.
Very sensible. And now, I'd like to ask you, you are the focal commissioner for older people. Why do we need a focal commissioner for public people, for older people? Why do they need special protection?
Thank you for that question. Of course, coming from national human rights institutions, the audience here are actually counterparts of the Commission on Human Rights of the Philippines. We have a duty to reach out to each and every sector of society, including older persons. And, the Paris Principles relating to the status of national human rights institutions, that's the gold standard where we are graded or accredited for, actually guarantees pluralism. And that really just ensures that the composition of national human rights institutions reflect social forces of civilian society so that we can better promote and protect human rights. So it's not only in our representation that we have to do that, we have to reflect older persons as well, but we have to do more so in our services, protection, promotion services, but also in our engagement with the community. And then as we know also with the COVID pandemic, it has really just made visible the vulnerability of older persons, and they were the most affected population. But then if you take a look at it, all these things that have been happening, the vulnerabilities have already been there even prior to the pandemic. So of course, we have aging population. The Philippines is slowly aging in population. It also necessitates us to address ageism, which is something so well entrenched that sometimes we don't even recognize it. And because of the aging population, the numbers of older persons are increasing. So we need to pay attention to them.
Karen, could you give us some examples of the kind of issues you've been addressing there in the Philippines?
Well, of course, like for instance, what we do in terms of trying to reflect the sector of older persons is that what do we do as national human rights institutions? We have the power to be able to monitor places of detention. So we have to ensure that we locate older persons where they are. Recently, what we did was to issue a human rights situationer on older women who are in detention. In terms of COVID response, for instance, what we did was to monitor the complaints that we have handled. And most complaints are coming from people who are not satisfied with government services during the time of the pandemic, and also because there were lockdowns. And older people are actually marooned in their houses because there was a singular criterion of age to restrict movement of people.
Okay.
And that actually is discriminatory against them.
Okay, well, we'll ask you about that a bit later on, but are there specific prison departments for older people, or are they mixed with the general population?
They are mixed with the general population. So that's why it's all the more important to be able to surface the issues of older persons amidst all these amidst all these population, because they have different needs, they are differently situated, and we must pay attention to that.
Okay, Mark, over to you. In America, the statute stipulates that in every state there will be a long-term ombudsman. Why for long-term care facilities? Why do you need that? Why can't just a general ombudsman investigate complaints also about that subject?
Well, first of all, thank you for the invitation this morning, Jonathan. It's a pleasure to be with everyone. Just a little bit of background. The nursing home industry has grown over the past 40 years or so, and so an increasing number of clearly the most vulnerable people in our population. In nursing homes today, we've got almost 17,000 nursing homes and 1.5 million residents. Many of these people have outlived their spouses, their families, adult children don't live nearby, and they have no ability to reach out for help when they need it. And so obviously, Dr. Fleming, who is the architect of the Ombudsman program here, realized that there needed to be some additional oversight. There needed to be a local presence, a local ombudsman everywhere. We're heavily relying upon volunteers to do that, given the sheer number of facilities. But these people truly are the most vulnerable in our population, and oftentimes are afraid to complain, oftentimes don't have the ability to reach out for help. And so they need somebody there. And what we discovered was the oversight from the survey agencies just wasn't sufficient. And so the Ombudsman program has grown over the years, and I'm pleased to say that while we started just in nursing homes, our program has now expanded into assisted living, or what some states call board and care. And there's about a dozen programs, including mine in DC, that has also expanded into resolving complaints from people that are receiving home-based care in their own home and in the community. So it's just really been, we see this program growing, we see the need growing. There's a high percentage of residents in nursing facilities that have dementia, and so really need someone in there monitoring their care. And I want to say, while our program was based initially on a Swedish model, we're not objective. We're clearly there as an advocate for the residents. We're helping them understand and exercise their rights, exercise choices that contribute to their quality of life, and so that they can live with dignity and autonomy, even though they're in a facility. And I want to say one other thing that Ombudsman are really trying to do, and that is trying to connect these communities, these nursing facilities and other care facilities to the larger community. I think we often look at these people as being siloed. They've been removed from society, and quite frankly, given the diversity of the resident population that we're seeing, they're like microcosms of the larger community, and so they're just like a neighborhood, and so they need to be brought in and connected to that larger network. And that's what Ombudsman.
Mark, could you tell us a bit more about your volunteers? It sounds a very interesting idea of having a greater human resource like volunteers. What do you do with them?
We're heavily reliant upon volunteers across the country. We probably have about 6,000 or 7,000 trained volunteers. They're total program representatives. They provide that regular presence. They're in facilities on a regular basis, talking with residents, establishing that kind of a trust relationship, because a resident's not likely to tell us things if they don't know who we are, or if they don't have a relationship. And so that's very important. And given the just sheer number of facilities here in the United States, it's critical. There's never enough staff, right? And so we rely very heavily on volunteers, and they go through a very comprehensive training program. And
Mark, can you give us like a specific example maybe of a case that you've received?
Well, it varies. The complaints kind of fall into separate categories of resident rights violations. Illegal evictions has been our top complaint probably for the last 5 to 7 years, where a facility, because maybe the resident is exhibiting some behavior that they don't like, they'll issue a discharge notice, involuntary discharge notice. And so a lot of our work is around that. Certainly many complaints, a high percentage of our complaints involve quality of care. And then there's also the quality of life, the kind of the routine, the food's not good, the lunch is always cold, that sort of thing. So, it runs the gambit.
Thank you very much, Mark. Rob, over to you. First of all, from a person born in Britain who studied in Manchester like me, I have to ask you the most important question. What's the weather like today in London?
Well, hello, Mazel Tov on your 50th anniversary. Chag Sameach, happy Hanukkah. These seminars, to me, are like the lights of Hanukkah. They cast a light on so many interesting issues. I've already learned a lot. And just to reassure you, the weather is always fine in Manchester. It's just a myth that it rains a lot, so we need to be clear about.
Now, Rob, is there a specific older person's ombudsman in the UK?
No, and that's a very interesting contrast with Mark. And also, very interestingly, I am required by law as a parliamentary and health ombudsman to be impartial between complainants and bodies in jurisdiction. But I am also required to be empathetic once I'm investigating a complaint. So there's a difference there, and it's something that perhaps we can talk about again. But what I need to say is that I'm not just the health ombudsman. As the parliamentary ombudsman, I also receive complaints from older people about non-health issues. And I think it's very important to recognize that older people have complaints about a whole range of things, not just health issues. If I could give you two quick examples of that, two very big and important issues involving older people in the UK. One is about the Windrush scandal, which you may have read about, where basically the government created a hostile environment to get rid of illegal immigrants. And they targeted citizens who had come from the Caribbean 50 years ago and had UK status, but weren't easily able to prove that after 50 years. And as a result, the government, the Home Office, harassed them and tried to deport them. And this meant that they lost their livelihoods and their freedoms, and some of them were actually deported, and some of them died before they could get restitution. So that's an issue about older people being caught up in something which was entirely unhealth related. The other quick example I should give you is that we have just published a very big decision where we criticize the government for telling women that they were going to have to wait much longer for their state pensions. But they didn't actually communicate this fact to them in any rigorous or systematic way. So many women becoming older people found themselves 8 years short of the pension they thought they could rely on. And that's a good example of a non-health issue. Right.
Issy, over to you. We've heard about some of the difficulties that older people face, but you as an expert on gerontology, you always prefer to focus on strengths and positive attributes and not on weaknesses. Can you expand on that point of view?
Yes, thank you. Let me please first join and begin by thanking the organizers for this excellent international gathering and for choosing to focus on the rights of older persons. And to your question, I think personally there's no doubt that older persons are facing difficulties and challenges. However, whenever the public discourse is focused solely on these issues, this gives rise to one of the major social phenomena which is at the root of the infringement of human rights of older persons. And I'm talking about ageism. I'm not going to give you a lecture on ageism. However, in the words of the late Professor Robert Butler, ageism is the process of systematically stereotyping and discrimination against people just because they are old, just as racism and sexism accomplish this for skin color and gender. So ageism discloses the fact that unlike aging, which is a normal and neutral biological process, old age and the values and attitudes and perceptions about it are totally artificial and the result of cultural constructions. So it is within this historical and cultural construct which older persons are portrayed as helpless, as victims of abuse and neglect, as those who cannot care for themselves, and as people which need to be placed under guardianship of others, etc. So it is this poor image that the popular media loves to use and distribute that portray older people as burden on economy, as people who cannot make decisions on themselves, and that we need to paternalistically take care of themselves. So my main argument is therefore that once we focus solely on the difficulties and challenges of older persons while ignoring their strengths, their contribution to society, to their families and to economy, we not only encourage ageism, but we actually support the paternalistic and ageist policies. So therefore, if we truly want to combat ageism, if we want to eradicate the negative social construction of old age, and if we want to truly make a social change and respect human rights of older persons, then we need also to focus on their abilities, their strengths, and their contribution to the social and cultural rights of society.
So Issy, do you think that there should be a separate ombudsman for older people, or do you think that's part of the stigmatism?
This is always a fascinating question. To what extent, when we develop and use specifically and focused and tailored services for specific groups, do we actually encourage and support agents, or do we go the opposite way? Personally, at this stage of history and development, I truly support specific and unique services for older persons. We need to make this social change and hopefully to aspire to the day that we can move back to general universal services, but we are not at that point yet. And until we reach that, we certainly do need specific and focused services for older persons.
Sylvia, over to you. Thank you very much, Issy. Sylvia, you work very closely with the United Nations, and just like about a month and a half ago, the UN Human Rights Council passed a resolution regarding older people. I wanted to ask you, why do we need that? I mean, shouldn't we be defending everyone with any kind of problem?
Yes. Hello. Hi. Good evening. Thank you, Jonathan. And thank you to all the panel. Of course, we support and we believe in universal human rights. But the reality, as Issy was saying, the reality is that unless you are explicitly mentioning the specific needs or rights of specific populations, they tend to be forgotten. The importance of this resolution is, after many years of requesting one, is the first substantive resolution on the rights of older persons. There have been some what is called procedural ones when they appointed the independent expert, which was a great advance, independent expert on the rights of older persons. But we always encounter that when we want to portray older persons as subjects of human rights, the narrative always goes towards older persons as only beneficiaries of care services. And that's why we wanted to put the issue of the rights of older persons and full rights holders. And the focus of this resolution was, or is, on ageism and age discrimination. So it's the first time that ageism made it to the formal human rights language, because many governments were actually opposing to have ageism, that they didn't think that that was human rights related. But age discrimination cannot be seen without the wider frame of the cultural and stereotyping and that Issy was mentioning about ageism. So we see this as a great step forward.
And what impact do you think it will have on ombuds institutions, or should it have?
Well, I think that ombuds people can use this resolution whenever they approach the government, or they have to mediate with the government, and they can use it. Look, your government have supported, or at least they haven't opposed it, but they haven't. The resolution was adopted by consensus without any vote, so everybody accepted it. So they can bring it as a resource and as help to say, you have supported this resolution, you have committed to respect the rights of older persons, and not only in issues that relate to care, but in all spheres of life. And as Issy said as well, we are talking about active participation in social, political, economic, cultural activities as every human rights holder. They can also, in fact, participate and interact with the independent expert. There are cases of many national human rights institutions like Karen's as well, or commissioners or ombuds people who really provide inputs to the thematic reports that independent expert presents every year. And so there are many occasions that the ombuds people can interact with Human Rights Council and the institutions or the special procedures in order to advocate or mediate towards the rights of older persons.
Thank you very much, Sylvia. I must tell you, my dear friends, I was hoping when we started to talk about this panel that we could speak about COVID in the past tense, that we could say, you know, oh, look, it's fading out and how wonderful, we have a new reality. And unfortunately, these days are not looking so good. And therefore, my next questions are going to be more relevant than ever. and not as a curious, but rather as something that we have to come to terms with. So I want to ask, I mean, it's been 2 really dramatic years and with unprecedented challenges, with really serious implications for the whole population, and I think particularly for older people in the way I've been seeing these cases. Rob, I wanted to ask you, how has COVID influenced your ability to fulfill your mandate?
It's been the most difficult 2 years in the history of the National Ombudsman, and I'm sure, having done the research together with the IOI, that's true for many of my colleagues. So because I'm a health ombudsman, we have had to rely very much on hospitals and general practitioners giving us information about cases which we're investigating. And because of the pandemic, they were simply unable to do that because they had to focus on the crisis and they had to move their complaints teams to frontline issues like bereavement counselling and so on. So for a very short period, for 3 months in 2020, we had no choice. We had to pause the investigation of health complaints because there was no way the hospitals could reply and they had to get on with handling the crisis. That meant that older people were kept in a queue which was going to take up to a year to address. And that is a very serious issue which we have had to address while at the same time working remotely and away from the papers and the files in the office. So we have had to take some very big decisions about how we help people and proceed without being able to routinely go out for liaison meetings or meet with stakeholder groups or meet with older people themselves. I mean, generally I would go to institutions and talk to people in the way that Dr. Ben Haim described, and that's very important.
So how do you do it, Rob?
We made a big decision that because of the limited resource that we had, given that the complaints were rising, that we had to change our demand management approach, and we have focused on the more serious cases that come to us, those involving deaths of older people, and not to handle the less serious cases which might involve complaints about the rudeness of staff in the health service perhaps a year ago. And interestingly, that has been well received by complainants and by bodies in jurisdiction as being seen to be a sensible, pragmatic approach to what is an unprecedented crisis. But that is how we're handling it. But I have to say, and I'd be interested in my colleagues' view about this, that what the pandemic has done has dramatically increased an already deteriorating position for older people. Hospitals have been under great pressure even before the pandemic. Our population is now at 20% of people who are over 65. So we're not going to get a quick turnaround to this. And we will have to continue not to handle less serious cases in order to retain authority and the confidence of the communities that we're serving.
That is really quite shocking. Mark, what was your experience? Or is your experience, or has been your experience?
Yeah, I have to agree with Rob. This has been the most challenging 2 years to try to do the work that really requires you to be in person on site. And we just haven't been able to do that. And I just want to first say and acknowledge that in the United States, 20% of all the COVID-related deaths were nursing home residents. And there were many other deaths that I think were related to the COVID that weren't counted that way. Staffing was a huge issue, a complaint that we kept receiving. People left nursing and healthcare facilities, and it exposed a problem that was, as Rob said, was already there prior to COVID, and this just kind of really laid bare that whole issue. For us, it was especially difficult because there was a total lockdown for 15 months, no visitation. Ombudsmen were not seen as essential workers, so we were not able to get into facilities either. We did the best we could by investigating complaints and responding to issues virtually, but that is no substitute for being there in the facility, having boots on the ground and eyes in the facility. So it was just very, very challenging. And we learned, I think, 2 lessons from this. One is family caregivers are essential. Caregiving does not stop at the nursing home door. And so now we're just beginning, as we've gotten back into facilities, the toll that this has taken, the physical and the mental toll this has taken on residents. Weight loss, people that could walk before can't walk now. And part of that is because families would normally come in, maybe assist with eating, maybe walk their relative around, and that was not being done. Because even during the lockdown, these people were quarantined. I saw a sign, this woman in a Minnesota nursing home, she was holding it up in the window and it said, "Please let me out." And many of these residents report feeling like prisoners during this lockdown period. But what we're seeing now is the effects of that and how important it is for family caregivers to have access to the facility, to do the things that the staff can't do because there's just not enough of them. The other thing that we learned is, and I think this may be a fortunate thing, is the use of technology moving forward. We distributed iPads to all the nursing homes, to the resident council presidents, and they were able to use that to communicate with each other and also to communicate with their families on the outside. So that helped a little bit. But I think in the future, families that can't visit routinely, COVID or such pandemic or not, the use of that sort of technology, I think, is going to be more critical moving forward. An unfortunate or maybe fortunate sort of revelation of this pandemic.
Yeah. Sylvia, I want to ask you, thank you, Mark, very much for sharing with us such terrible experiences. I mean, you as well, Rob. It's really shocking to hear that the ombudsmen are not defined as essential workers. Sylvia, I mean, don't you think that ombudsmen should be defined as essential workers? I mean, who is looking after these people in long-term healthcare centers if not the families and not the ombudsman?
Absolutely. I believe that they should be essential workers. I think that it was absolutely tragic to forbid all visitations. In fact, the nursing or the caregivers or assistants or carers, they were coming in and out and they were transmitting also the virus. And so the decisions to lock the people not only to the institutions but sometimes to their rooms were really kind of easy solutions. But what we have been hearing is about horrible reports of neglect. That really led to deaths and abandonment. We saw horrific stories on newspapers, on institutions being left alone and abandoned people to die. And they were found by the military, by the army in Spain and even in Canada. So I do believe that, first of all, I do believe that older persons have the right to live independently in the community. But if they cannot live independently in the community, they need to have the right to access to justice all the time, to have the right access to information, the right to defend themselves, the right to complain, the right to somebody to observe what it takes place in a prison-like situation.
Thank you, Sylvia. Karen, over to you. You made a statement a few months ago about improper implementation of quarantine guidelines, and you started talking a little about it previously. We also heard that there were demonstrations in the Philippines by older people. Can you tell us a bit about that subject? I mean, what was going on there?
Yes. Well, actually, when the COVID restrictions were coming in from government, what happened was that there was a singular criterion of age that was imposed for restriction of movement. So government said, okay, if you're over 60, you can't go out. But then in terms of policy, if you read the fine print, it says there, but there are exceptions. You can go out if you're doing essential activities like going to the grocery or going to the hospital if you need medical attention and what have you. But then when you look at the conditions on the ground, we receive many complaints of against local government officials and also private establishments who have barred older persons from accessing facilities like entry in supermarkets to buy goods, denying them access to needed transportation to have access to work. And then last year during Labor Day, there were some, we call this the transportation drivers, the public transportation drivers. We call them the jeepneys, and they went on strike, but then they were also arrested, and they happened to be more than 60 years old already. So they were saying, oh, this is a violation of health protocols and all that. You know, in these situations, we have to realize that there are many phases of older persons. Not all older persons are taken care of by their families who can do the essential activities for them. There are older persons who had households, some live alone, some have disabilities, others really still need to go to work every day to be able to earn a living. So these have to be considered by government. That's why we were prompted to issue a statement. Because when they impose restrictions, they also result in negatively impacting the rights of older persons. Governments have to realize and reflect this in their overall response or rollout on COVID response, no? That they have to realize that it's not only the virus that poses a danger to older persons, it's also the measures that are intended to quell COVID that actually affect and have counterproductive effects on older persons.
Yes, thank you very much, Karen. Really shocking, really shocking. Issy, do you think that maybe some of the approach to COVID and the restrictions imposed, maybe ageism was a factor in the way that these issues were dealt with?
Well, as my colleagues have mentioned, I think that, at least in my mind, I have no doubt that ageism was a significant factor during the COVID-19 crisis with regards to the difficult situation, and not to say the severe human rights infringements to the rights of older persons. As others mentioned, it did exist prior to COVID-19, but the extent and the depth of ageism and the way it was manifested during the last 2 years only showed the need to directly and clearly address this social phenomena. I will give two Israelis examples to add on to the examples we heard already. First, here in Israel, during the first days of COVID-19, when we still did not know exactly the scale and the scope, and there was a sincere fear that there would not be enough sufficient numbers of ventilators to the COVID-19 patients. Here in Israel, during those early days, in a very well-known Israeli newspaper, several chief managers of key public hospitals went on publicly to say that if there will be a shortage in ventilators, and they'll have to choose between older patients and younger patients, they'll choose younger patients. They didn't care about any other valid or relevant factor, but simply chronological age, regardless of any other factor, for them was sufficient to discriminate and to choose to prefer younger patients over older patients. A second example was with regard to the workforce. Here in Israel, after the first closure, the government started to allow workers to go and to return to their working places and opening up the economy. However, during those phases, older workers, workers above the age of 67, were not allowed to go back to the workforce and had to stay at home. And not to mention that as older workers, they were not entitled to unemployment benefits as opposed to younger workers, which were entitled. However, I would like to pose maybe a controversial argument, and also to argue that there were actually some upsides to this ageist manifestation during the COVID-19. And I'll give you two examples. One, at least here in Israel, these very blunt ageist approaches and policies actually gave rise to some very significant social activism, what I call ageism, by older persons. So suddenly we heard older persons who realized that they are discriminated against to be very vocal against those government policies. Secondly, referring to Mark's comment, there is now a stronger voice against institutionalization of older persons and a strong movement towards much stronger community-based services in light of what we experienced in nursing homes and institutions for old age. So we can see also some upsides to these ageist policies as an outcome of COVID-19.
Thank you very much, Issi. Well, I mean, a lot of ombudsmen report that they feel that they're not succeeding in getting to the right number or the right percentage of older people. They look at the figures and they say, you know, there are so many subjects that these people could be putting complaints about, and the number of complaints we're actually receiving are much less than we would actually expect to receive. Now, in the UK, in Robert's office, there was a very, very interesting report called Breaking Down the Barriers. And there they addressed the low complaint rate kind of low, according to what you would expect, let's say in that way. And they gave three main reasons: that maybe people were having a lack of confidence and knowledge of how to submit a complaint. They were worried about retaliation. And also they felt they lacked support in order to make complaints. Rob, I would really like to ask you, it's your office's report from several years ago, and I'd like to hear what the recommendations were and how you feel that the situation has improved since then, if it has improved. We can't hear you, Rob.
Okay, can you hear
now
me
we
now?
can. Yes, fantastic.
I mean, the situation has not improved. It's probably got worse. And it's important to be realistic about this. Although the report was a very good one and it revealed exactly as you said. And we argued that two things should happen. We said that organizations in jurisdiction had to reform their complaint procedures so that they made people aware of what their rights are and communicated with them in a way which was sympathetic and related to their capacity in terms of digital availability and family support. And we also said, secondly, that the NHS should include in its quality control a look at how effective complaints handling is as a way of improving service. And frankly, nothing was done to respond to that. So we commissioned another survey 2 years later with GrandsNet, which is a grandparents' social network and also a policy think tank. And we got 600 grandparents to participate with this. And we found the same thing, that we found that what they were saying was that their elderly relatives being treated in hospital were not treated with respect, weren't listened to, and were afraid to make complaints in the same way that they had reported 2 years before. And the most frightening of all was these people, perhaps in their 50s, were saying, we don't think it's worth complaining given the current situation. So even when our parents are not being treated well in hospital, we're not sure it's worthwhile complaining. Now, that is very concerning, particularly where they report their parents suffering pain in hospitals and being neglected as a result of shortages of staff. Those are human rights issues. And I know of one person who was locked in a psychiatric ward for 9 months because they couldn't find a place to put him in a care home. I mean, that is a fundamental breach of human rights. So, Jonathan, what we have done is we've changed tack and we consulted for a year on developing a new complaint standards framework for the whole of public administration in the UK, starting off with the National Health Service, in which we set out a model code of what good complaints handling looks like at the hospital and GP level. And this has been accepted with great enthusiasm. We now have 100 pilot hospitals and GP practices who've adopted it to see whether it works and how it can be improved. And what that means is that bodies in jurisdiction have to actually train people who are handling complaints so that they're aware of the stereotypes, they're aware of the need to complain, they're aware of the need to speak in a language which people understand, rather than just assume, as so often happens in bodies in jurisdiction, that anyone can do a complaint, and that's why it's so badly received. So we think that this has had a dramatic impact on the views of people who work in the health service. They see it as a positive development, and we look forward to institutionalizing it within the next 12 months, and it's been supported by complainants, by the government, and by stakeholders and advocacy groups in a non-partisan way, which is very encouraging.
Thank you very much, Rob. Mark, do you experience similar barriers? And if so, how do you overcome them?
Right, we do. And I just want to reemphasize the importance of having a regular presence in facilities to develop a relationship with the residents, and also a working relationship with providers, so that when there's an issue, we can quickly and easily address it. But if people don't know you, if they haven't seen you, if they don't know about you, they're going to be less likely to confide in you, and less likely to reach out for assistance. But there's a number of barriers and challenges, non-COVID related, that we've experienced over the years. One is oftentimes people fear retaliation. They don't want to be labeled as a complainer, and so that's a huge issue. The other is ombudsman, and I think this is important for us, for ombudsman in the United States. We're not mandated reporters. So generally, there's laws that cover healthcare professionals in the United States that say if you know or suspect of abuse, neglect, or financial exploitation, you must report it to the authorities. We are exempt from that, which allows, because confidentiality, quite frankly, is the cornerstone of this program, and it allows people to be able to tell us what they want and to direct us. So they could tell us horrendous things, but then if they turn around and say, but I don't want you to say anything, we don't. And that can often be a bit of a burden to carry, but we do our best, and there's several ways that we can address this. If the complaint is not too resident specific, in other words, they're complaining about the food or the amount of time that it takes for someone to come and assist them to the bathroom, but they don't want to be the complainant, we can walk around and talk to other residents. And if we see this as a systemic issue, the ombudsman becomes the official complainant of record, and we can address it that way. That allows the resident to maintain some anonymity. The other way we do this, and this is very important, we work very hard to develop resident councils, because there's safety in numbers. And oftentimes residents feel like I'm the only one that's experiencing this problem. But with a resident council, a group of residents coming together, identifying a common issue that they can then take to the administration of the facility and address it that way, oftentimes helps. So we spend a lot of energy trying to help and support the development of these councils. So that's just two ways that we try to address this reluctance that sometimes residents have. And I'll just say this, I think the current generation of older adults in facilities are just less likely to complain and accept what they're getting. In the future, I think that's probably going to be less likely the case.
Let's hope so. Okay, I want to go over now to Sylvia. Sylvia, I would like you to give us some practical advice, some tips, how we should act as ombudsman, something we can take away with us to have a better approach to complaints of older people and better ways to help them.
Thank you. So you don't want to talk about the barriers, but just to go to the recommendation.
Your practical advice, yes, certainly.
Fine. So yes, first of all, I would like ombudspeople to be really proactive. I would like to reach out and raise awareness of the rights of older persons, because many don't know what the rights are. Many don't know who to go to, where to go to. So I think that it's important that the offices of the ombudspeople, that they reach out and they they raise awareness, not only on digital means, but also with any analog media or traditional media, newspapers, radio, TV. People need to know where to go. I also would like the ombudspeople to advocate for the rights of older people and to join civil society who call for a convention on the rights of older people. I would like to see all national human rights institutions. I would like to see all ombudspeople to be supportive of that call, because we need support. And I think that we need the convention. And I think that the one sentence is really to enable access to justice and remedy. And like Mark said, that to be able to provide a safe space that older people can complain when they need or can talk to somebody.
Thank you very much, Sylvia. Issy, please, can you give us your tips and advice how we can do our job better?
My practical advice is to listen to the authentic voices of older persons, and moreover, make older persons your partners. And when I say listen, I mean to proactively reach out to older persons and listen to what they have to say, what are their preferences, their wishes, their perspectives. Do not assume, or we should not assume, we know better. We should not assume we know what is good for them. We should not act based on our prejudices, biases, and ageist attitudes. We should transform older persons from subjects to partners. Let their voices be heard, take them into account, and make them an integral part of the formal institutions of Ombudsman.
Thank you very much, Issy. I want to go over to Karen. Karen, what is your practical advice to all of us? We can't hear you. Maybe you're on mute.
Yes. Thank you, Jonathan. We just have to reach out to older persons through, as has been mentioned, civil society organizations, but not only that, through government agencies, because national human rights institutions, after all, act as a bridge that leads civil society to government and vice versa. We need to ensure that government agencies that have direct mandates on service delivery for older persons are also capacitated in the human rights-based perspectives, approaches. We also need to ensure that, these celebratory events or commemorative events like World Day Against Elder Abuse on June 15 or October 1, International Day of Older Persons, they're not just days that we can just, have a party and all that. It's a day to be able to reflect and to be able to showcase what's happening with older persons in our society. In the Commission on Human Rights, we have a human rights legislative agenda that covers legislative proposals that will enhance and will address the lack of services, the gaps in responses to older persons. Like, for instance, in the Philippines, we still don't have a long-term care law. We don't have an elder abuse law. And all those in universal health care, we want to enhance it to ensure that older persons get the health services that they need. So we really just have to reach out to them. And every time we have events, we invite the sector, we give them a part, we allow them to participate, and as has been said earlier, to let their voices be heard.
Okay, thank you very much, Karen. Over to Rob. Rob, what practical advice can you give to us?
I've got 5 things, if I may. First of all, ombudsman schemes should be representative of the communities that they serve. And this is very important that we have within our institutions people themselves who are older people who have the lived experience to be able to empathize and to communicate with fellows outside of the institution. We talk about this in terms of gender, in terms of ethnicity. We should be talking about it in terms of age too. So that's the first thing. And I can disclose to this private grouping that I am an older person. So, I'm not going to be stereotyped into thinking that when you get to a certain age, you're not useful anymore. Just look at the man behind me to prove that. Secondly, as everyone has said, this is a human rights issue. Even if you're not a Ganry institution, even if you're not a human rights institution, these are fundamental issues. And actually, Sylvia, we need the United Nations, we need the Venice Principles and the United Nations Declaration on the Ombudsman to embarrass governments into supporting Ombudsman when they take on these issues, because we can't solve it just between ourselves and internally. So I think that's very important too. The next point is, my penultimate point is that there is such a thing as grandparent power. I have an outreach radio program called Radio Ombudsman, which you should go onto our website to have a look at. And recently, I did an interview with a grandfather who took over his family's complaint about the tragic death as a result of neglect of their 5-day-old son. And he has marshaled the evidence. He's got the press on his side. He's been a formidable advocate. This was something the parents didn't feel able to do. But he, as a grandfather, slightly different in his relationship with the grandson, has been able to be a pillar of responsibility and authority in this. And we shouldn't just see older people, as everyone has said, in terms of not being able to do things and being disabled in that way. And the very last point is, if we don't reach out, if we don't go out into communities, even during COVID now, there are ways of doing it, and doing it vicariously if we can't do it directly through stakeholders and advocacy groups, we're finished, because ombudsman schemes tend to wait for articulate, middle-aged people to come to them. They feel confident about that, but other people don't, and we have to go and reach them.
Thank you very much indeed, Rob. Over to Mark now.
Thanks, Jonathan.
Practical advice. Thank you.
Three things. But first, I want to agree with Rob on, as I get older, I don't want to be stereotyped either. I would prefer not to be referred to as old. I would prefer to be referred to as chronologically gifted. I think saying things are old is just negative. But three things I think that I think are important. One is access to the program. We need to do a better job, as Robert said, reaching out so that people know how to reach back to us. And that's if they don't know we're there, we can't help them. Second, and this might be the most important thing, is we need to work to empower individuals to self-advocate when possible. There's never enough ombudsmen to go around. Everybody's going to experience some type of problem sooner or later, wherever they're at. And so to the extent that we can inform them of their rights, give them the tools they need to self-advocate, I think that's just going to be critical moving forward. And finally, I think we need to educate the broader community, our governments, our representatives, our broader community about what we do as an ombudsman. I think it's very misunderstood in terms of what our role is. And I think we just need to do a better job promoting ourselves within the broader community.
Fantastic. I want to thank you all for such great wisdom and such great ideas, such experience. And now let's see how you can deal with the questions from our audience, because I'm sure we have questions, and let's see what you have to say about them. Okay. This question is obviously to Karen. Being a human rights institution, Karen, what is your interaction with the Ombudsman Office?
Well, with the Ombudsman's office in the Philippines, they're more into investigating anti-corruption issues, which are, of course, human rights issues as well, because it impacts corruption, actually impacts on human rights as well, no? But one of the things that we have been doing is, after our investigation, if we feel that this is something that should be prosecuted, when it involves government agents, then we pass it on to the Ombudsman. And as a national human rights institution in the Philippines, we don't have prosecutorial powers. We do have the power to recommend after we investigate complaints. That is why we refer to the Ombudsman. So basically, that's it. How we interact with the Ombudsman is really to refer to them the complaints that we feel should be prosecuted and should be brought to court.
Thank you very much, Karen. Sylvia, what interaction do you have with Ombudsman?
Well, I'm a funny specimen because I have interaction with several ombuds people. I don't like the use of ombudsman. I
You're
prefer
absolutely
ombuds
correct.
people because there are ombudswomen as well in different countries. So in fact, today I was interacting here and I interact with the ombudsperson office in Georgia or the Defensor del Pueblo in Peru or in Argentina. So I do have, with my international work, brings me in touch with different ombuds people around the world. So I know it's a very complicated to understand because in different countries there are different systems, and in different countries sometimes they are part of the National Human Rights Institute, sometimes they are separate, and so it really, I think that what Mark said about promoting themselves, about people understanding how the system works, it's complicated, and I agree with Bob that we need to promote the more acceptance of the role of ombudspeople among the member states. And I think that in the Human Rights Council, we do that a lot. And I would like to say proudly as well that national human rights institutions and ombudspeople are part of the open-ended working group on aging, and they are full participants like others.
Thank you very much, Sylvia. And let's go to our next question. If we have another question. Do we have any more questions? Okay. Rob, this is obviously a question to you. What kind of complaints did members of Parliament submit on behalf of older people during COVID?
Yeah, well, first of all, I have to say that our law was created in 1967 and is hopelessly outdated. So there are many reforms which are necessary to make us a better ombudsman scheme. We're very good, but we want to be brilliant. And one of the things we need to get rid of is what is called the MP filter, in which citizens have to go through their MP if they want to make a parliamentary complaint. And that chills people out. It means they can't come directly to us. It can take up to a year to get through the process, and that is very serious. But that doesn't apply to my powers as far as health complaints are concerned, when people can bring a complaint directly. As far as MPs bringing health complaints then is they don't have to intervene. But there are some real issues which are emerging about what has happened as far as COVID is concerned. One is that non-COVID hospital treatment has suffered dramatically as a result of the focus on COVID. That is not a criticism of hospitals, it's a reality of the crisis. So we have a large number of complaints from people with very serious illnesses who don't get the treatment that they need as a matter of urgency in, for example, the issue of cancer. And, you know, that is very serious, and that is a trend, number one. Number two is that there is a lot of dissatisfaction about the lack of availability of protective equipment, clothing for people to go into hospitals and GP surgeries, which hasn't been available, or it's been unclear what the rules are, and people are unhappy about that. I'll just give you two more examples. The third one is that people don't like remote discussions with their general practitioner, with their doctor, about very personal matters that they would normally go to the surgery about. And GPs have tended to say to people, we're going to do this online, you can't come to us directly. And people see that as an infringement of their personal rights. The last point is you do have to go to your MP if you have a problem with your social welfare benefits. And there has been a dramatic change in the status of people in employment, because we had a big furlough scheme where the government subsidized people for not working, and then that faded away. So some of the fundamental benefits that people had, they've lost, and they have to go to their MP to try and get us to have a look at that. And we're doing that, and that is a non-health but a serious economic issue which needs to be addressed.
Thank you very much, Rob. Let's see if we have any more questions. Okay. What does the current young or adult generation have to do today in order to ensure that when they will be old, they will not have to deal with the challenges that older people face today? Issy, let's hear what you have to say about that one.
I would say that what they have to do is to engage with older persons. We need to transform our society into a age-diverse, multi-generational society where young and old work together, live together, engage together, and see each other as equals. So if younger people today will engage with older people, the next generation will engage with them when they will be old the same way. So we need to transform our society into an age-neutral or age-friendly or multi-generational respected society. And I think that's the way to move forward.
Thank you very much, Issy. And Mark, what do you have to say about that question?
Yeah, Jonathan, I just to add on to what Issy was saying, I think we need to do a little better job helping people pre-plan. It's not a subject people want to talk about often, but it's important. And I think, we do a great job, at least in America, on researching how we're going to buy products from cars to washers and dryers, but we do very little pre-planning and research on if I need assistance or care, how am I going to get it? How am I going to pay for it? All those sorts of important questions. And the time to try to figure that out and navigate the system isn't at the point you're in a crisis. We often get calls from families saying, Dad had a stroke, he was in the hospital, they're going to discharge him. We can't take care of him by ourselves. What are we going to do? That's really, you're then past that time. So pre-planning I think is critical. And now, with the internet and everything else, it makes it easier for the next generation, I think, to be able to do that and to be able to access information that they're going to need.
How many of your volunteers are actually young, and how many are like seniors in themselves?
That's interesting. The majority of our volunteers are retired individuals, 60 and older. One of the things that we want with volunteers is somebody that's going to be consistent and that will stay with us for a while so they can establish the relationships we want. And so to some extent that leaves out some of the younger folks. We've tried to attempt to recruit from universities and wonderful people, very committed, compassionate, but time limited. And what we really want are volunteers that are going to stick around. And the other thing about our volunteers, because we assign them to facilities in their own neighborhoods and areas, is oftentimes they know the people that they're visiting. And I think that's important. They've already have some relationship established. And I think that's critical as well. But for the most part, they are older.
That's very
They're chronologically gifted.
Chronologically gifted, fantastic. Okay, let's see if we have any more questions. Okay, when a family member complains on behalf of an older person, do you communicate with the family member only or also with the older person? Wow, that's a great question. Sylvia, what would you advise on that issue?
Sorry, pressed the wrong button. Okay, I believe that it's good that people need to advocate for somebody who cannot advocate for him or herself. However, I think that the role of the ombudsperson is to check that the person is not able to complain or to express him or her wish. And I think this is extremely important, that is checked, that it reaches and tries to get, or not tries, gets the perspective of the older person, him or herself. Because we need to understand as well that families can be protective, can be overprotective, but can also be abusive. And we do know that the largest percentage of abuse actually happens in the community and it's perpetrated by family members. So we need to take when family members call, we need to really welcome the call, but we need to investigate and see what's going on.
Mark, have you had any cases of abuse of representation by family members?
We have, and I just to agree with Sylvia, we are very resident focused, and so we'll get an outside complaint, but our first step is always going to be to go to the resident. And we've had an example of this number of years ago. A daughter called and complained about the care of her mother. Another daughter called, in the same family, complained, different issues. We went to the resident, and she said, "I'm fine. Those are just my daughters. They never got along, and this is just the result of that." So it's absolutely important. And when I mentioned the piece about us not being mandated reporters, there's a reluctance. There's a lot of financial exploitation cases that we receive are based within the family. In other words, it's an adult child perhaps that's not making a co-payment to the facility or in some way exploiting the person financially. A lot of residents don't want their adult children prosecuted, and so we'll know about this. We'll try to help address it, but they don't want to move forward. And so being resident focused, we're only going to do what they want us to do.
Thank you very much, Mark. I want to address all of you in this panel. I want to tell you something that you don't know, but in our office, we met with every one of you as we were arranging this panel. And every one of you, we had the same reaction. We said, "You have given us such inspiration." And I think all the audience back at home will agree with us that you've given us tremendous inspiration, tremendous wisdom and practical advice, and so many things to take away with us and to implement. Thank you very much indeed. And I would like to thank also our panel team, Tetsuya Meidad Luzon and Sipora Phillips, that did such fantastic work with arranging this panel. Thank you very much indeed.
Thank you so much, dear panelists, and thank you, Jonathan. It was a fascinating panel, and we learned so much from it. I'm sure every one of us will get quite a few tips that will be beneficial to our work.
No doubt at all.
Thanks.